Welcome to Annals Animated. Our video will look at an important paper in the Annals of the American Thoracic Society. Here we discuss Cough in Adults with Undiagnosed Respiratory Symptoms by researchers from Canada. Researchers in Canada investigated the relationship between the burden and severity of chronic cough and the impact on quality of life, sleep quality, and healthcare utilization among adults with undiagnosed respiratory symptoms. Recruitment involved random phone dialing and screening of those reporting symptoms within the last 6 months. A control group was age-matched for comparison. Patients were screened for asthma, COPD, and general respiratory symptoms. A cough score was determined based on factors including persistence, frequency and intensity, sputum, pain, fatigue, and exacerbating factors. Higher scores indicated a worse impact. Demographic information included income, medical conditions, smoking history, occupational exposures, and healthcare encounters within the last 12 months. Quality of life was assessed across domains, including physical and emotional functioning and limitations, energy or fatigue, social functioning, pain, and general health. A lower score correlated with decreased quality of life. Spirometry was performed, and patients were labeled as having either COPD, asthma, preserved ratio impaired spirometry, or PRISM, or normal spirometry. 2,857 symptomatic adults were enrolled. 330 were diagnosed with COPD, 265 with asthma, and 172 had PRISM. Those with COPD and asthma had more severe cough scores. More severe cough symptoms were associated with worse lung function. Cough scores increased in those younger in age, with gastroesophageal reflux disease and with higher smoking exposure. Higher cough scores were associated with decreased quality of life and decreased functioning across all domains. Higher cough burden was associated with greater sleep disturbance and higher rates of healthcare utilization. This study demonstrated that those with the highest cough scores were more likely to have a diagnosable and treatable respiratory condition. Clinicians and patients should seek early evaluation of undiagnosed chronic cough. Prompt diagnosis and treatment may reduce detrimental effects on health and quality of life and reduce overall healthcare costs. For more information, please read the article by Dr. Shojung Shin and colleagues. Thank you for watching Annals Animated.